Afternoon. Today I'm talking about the managing stress and self-care during COVID-19 for the health workers. Here I'm talking about related to the mental health. Like the whole health begins with the mental health. Nurses make up the bulk of the healthcare workforce and are the natural problem solvers and innovators. We therefore stand out as the indispensable at any time, but especially during the public health emergency. Prioritizing self-care becomes more crucial than ever during a time like this. Burnout significantly impact on the health and the ability to provide the best possible care. Taking steps to manage stress and anxiety is just as important as taking care of your physical health. Managing the stress, acknowledge and understand your reaction. In here the appropriate that you will have the reaction to the increased stressor you are the encountering, such as the lack of the inadequate rest, unmanaged or the disturbing eating schedule, or the information overload, increased work and the personal responsibility and limited resources. Exercise self compassion and recognize that almost everyone impacted by an emergency will experience psychological distress. These reactions are by no mean an individual of the weakness. Understand that anyone helping during this time is susceptible to the secondary traumatic stress, and a nurse, you are especially vulnerable. Be aware and monitor your well-being, in that the check-in with yourself and monitor for the common physical and mental symptoms of the secondary traumatic stress. In that contact a provider if these symptoms impact your ability to provide care to your patient and your family in the same way you did before the pandemic. If you feel overwhelmed by the sadness, depression, anxiety, or the helplessness, consult to the do the psychiatric consultation. In the activate your parasympathetic nervous system to combat the stress. First, you have to do the practice breathing awareness. You have to do, and you have to maintain your regular eating habits or the schedule or the meal, and avoid food that increase inflammation in the body. Use a daily routine to prepare for the bedtime in order to the promote quality sleep. Try the mind body practice, like the yoga you have to do, and the yoga and exercise meditation you have to do, and maintain your social connection through the channels available to you. You have to use that one, and take time for your mental health. That means here take a break from media coverage around COVID-19. Next one is the set aside time for you and your family to recover, and make time for self-care, such as the talking with the friends, reading books, watching movie, and doing exercise, meditating, and doing the yogas. And the important reminders for nurses: you will have the reaction to the increased stressor you are encountering. Exercise self-compassion. Almost everyone impacted by an emergency will experience psychological distress. Nurses are the susceptible to the secondary traumatic stress during this time. It is not a sign of the weakness. It is the easy to play up with the importance of the self-care to our patient, while downplaying it to ourselves. Resist that urge. Help is available for the symptom you are the expressing impact your ability to provide care to your patient and your family in the same way you did before the pandemic. Connect with your purpose, like the acknowledge the crucial and noble work you are doing right now. And the next is the COVID-19 psychiatric mental health nurses. In that, during any crisis, or the psychiatric mental health nurse have the critical role to play, provide essential mental health care and psychological support to those impacted. Almost everyone will experience psychological distress at some point during a time like this, and those with the severe mental health or the substance use disorder are especially in need of the support. Psychiatric mental health nurses stand ready to ensure safety and continuity of care for their patient in the midst of the challenges and the uncertainty. As always, rely only on information from the trusted sources is the necessity, as it's seeking out support where it is the needed. Coping during the stressful time in here, alarming yourself with the information and the resources is the pointless if you are the too stressed and burnt out to provide care. Strategies to manage stress and anxiety are the more crucial than ever. Be on lookout for the symptoms of the secondary traumatic stress in your, and checked out the these strategy for the nurses on the managed stress. What is the secondary traumatic stress? In here, the secondary traumatic stress, also known as the compassion fatigue, it is the natural and common byproduct of the working with the traumatized individuals. Like the healthcare workers, such as the nurses, are especially susceptible to it. Secondary traumatic stress has the observable symptom, and it is the treatable. In mainly symptom of the secondary traumatic stress disorder, in mainly I have mentioned over here the four area. First one is the cognitive. In people have the people will show the individual will show the cognitive symptom like the lowered concentration, apathy, and the rigid thinking pattern, and the perfectionism and preoccupation with the trauma. And the second one, the emotional symptom, like individual will feel the guilty, anger, numbness, sadness, helplessness, and hopelessness. In like similarly, in the behavior problem, individual will so the like withdrawal symptom, the sleep disturbances, like appetite changes and hypervigilance, and individual will think elevated like the stress responses. And the same like individual will show the physical symptom also here, the increased heart rate, like the difficult breathing, muscle and joint pain, impaired immune system, and increased severity of the medical concern. Like behavioral health, like what is the behavioral health here is the state of the mental emotional being and or the choice and action that affect the well-being. Behavioral health problem include the substance abuse or the like the misuse of the drug or the alcohol and the drug addiction, serious psychological distress, suicide, and mental and substance use disorder. This includes a range of problems from the unhealthy stress to the like the diagnosable and treatable disease, like the serious mental illnesses and substance use disorder, which are often chronic in the nature, but chronic in the nature, but that people can and do recover from the disease. The term is also used to describe the service system service system encompassing the promotion of the emotional health, the prevention of the mental and substance use disorder, substance use and related problems, treatment and services for the mental health and substance use disorder, and recovery support. In here we can do the psychological first aid. First one is the we have to do the promote safety. How to promote the safety is the first is the help people obtain emergency medical attention. In the second point, help people meet basic need for the food and shelters. And third point, we have to provide is the provide repetitive simple and accurate information on how to meet these basic needs. And the second one is the promote calm. Listen to the people who wish to share their stories and emotion. Remember that there is no right or the wrong way to feel. Be friendly and compassionate, even if people are being difficult. Offer accurate information about the distress or the trauma or the infection or the inflammation and the relief efforts underway to help victim understand the situation. Third point is the promote connectedness. Is here connectedness is the help people connect to friends and loved one through the giving accurate information regarding the particular disease or the or the infection. Keep families together. Keep like children with parents or the other close relatives whenever possible, even though you are in the hospital or you are quarantined. You have to connect with them through the internet, through the phone, through the like Facebook, through the Viber. You have to be the connected with that. Next one is the promote self-efficacy. Give the practical suggestion that steer people toward the helping themselves and engage people in the meeting their own needs. And next point is promote help. How to promote the help is here. Find out the types and location of the government and non-government services where people will get, and direct people to those services that are available. And when they express fear or the worry, remind people if you know that more help and services are on the way. In here, promote help here when people are suffered from the COVID. We have to connect. We have to tell to the people where will be the PCR testing. Yeah, where we will be the admitted in the COVID hospital. We have to the help to the clients. And in the last point, do not force the people to share their stories with you, especially very personal details. When people having the very personal details, should not force to them through the share. And do not give the simple reassurance like everything will be the okay, or at least you survived. We should not tell that one. And do not tell people that you think that they are they should be the feeling or the thinking or how they should have the acted earlier. And do not tell people why you think they have suffered by the allowing to victims and personal behavior or the beliefs. And do not make promise that may not be the kept. And do not criticize the accepting services or the relief activity in front of the people in needed of these services. And do not criticize to the people like he or the she is suffered from the COVID-19. Just now she recovered, or she having the very difficult condition. We should not tell and we should not criticize to the people. Thank you so much for the listening.